In a previous video, I've talked about OSFED, which is Other Specified Feeding and Eating Disorder. And what I talked about with that diagnosis is that it's an eating disorder diagnosis that tends to be diagnosed when someone doesn't meet all of the criteria for another eating disorder. So today I want to talk about that a little bit more specifically and talk about specifically atypical anorexia. Atypical anorexia would actually fall under the OSFED category when we're talking about the Diagnostic and Statistics Manual 5 or DSM-5, which, if you remember from the past video, is how you diagnose eating disorders. But the description of atypical anorexia is a little bit different. So I'm actually just going to read it to you so that we're clear on all the verbiage. It's the individual meets the criteria for anorexia and has sustained significant weight loss as a result, but they remain within or above the weight range that is considered normal for their height and gender. So to summarize, basically what's happening is they're restricting their intake. They have a severe fear of gaining weight. They have psychological impairment that's impacting their day-to-day, which would be some of the categories that fall under just anorexia nervosa. However, their weight is within a normal range, which then lumps them into that atypical anorexia category. Now, this is actually very, very common. And unfortunately, this frequently goes undiagnosed or completely overlooked because of that one factor, the weight, right? So what'll happen is someone will go in, they will say that they're struggling with their eating, but their weight is fine, maybe their labs are fine. So they're told that they're fine, despite having this horrible day-to-day thought that they are too fat and they need to lose weight and they're probably restricting their intake and maybe over-exercising and doing all of these things. I've actually talked about in another video about exactly that, like kind of what to do when a provider doesn't believe you, but I digress. So today, let's take a look at a case study of an individual who met this criteria. Her diagnosis based on her medical record was atypical anorexia nervosa, and I'll explain why. First, let's take a look at this person's body composition just so you kind of see where she came in when she was starting. Now, this person is 5'6" and was 121 pounds at the very first visit. Now, remember, that kind of falls within that normal weight category, which is why she's falling under the category of atypical anorexia nervosa. Now, what helps her actually meet that criteria is the fact that this was a significant weight loss for her. About a year before coming into this first visit where we have her weight here, her weight was 146 pounds, okay? So she had dropped a significant amount of weight, and how she had done that was severely restricting her calories. By the time she came to see us at this visit here, her intake was about 1,000 to 1,200 calories a day, but over the span of this past year or so, her intake had dipped down to about 500 calories a day for a few months, really, really restricting. The other thing here is this person was exercising pretty heavily. She was doing 6 to 7 days a week for about an hour to 2 hours, and it would vary what she did. Sometimes it was a workout class, sometimes it was running, sometimes it was biking, etc. So this is someone who definitely was struggling with restricting their intake and over-exercising. Now, from more of a psychological standpoint, the other thing that this person was dealing with was that really strong fear of gaining weight. So remember, this person is 5'6", as you can see, and before coming in and before all of this weight loss and some of this disorder came to light, her weight was 146 pounds. Now, that's actually still a perfectly appropriate weight for someone of this height. However, she thought she was way too fat. She described herself as obese at that weight. And so that's really where this kind of came from. And then what happened as she started to lose weight is she became more and more fearful of gaining any weight whatsoever. She was weighing herself multiple times a day. If she saw the weight on the scale come up by half of a pound, she would restrict her intake. Or even as of recently, she had gained a little bit of weight. She had gotten all the way down to about 117 pounds, but then gained to 121. And even that amount has her absolutely freaking out. So that's kind of what helps meet that criteria for anorexia. Now let's take a look at her metabolic test. So based on her metabolic test that you can of course see here, that metabolic rate is way too low at 899. It should be up at 1400 or even higher, and it's dropped significantly, all from this very significant weight loss, this restrictive intake, and the overexercise. Remember, her body is compensating for being underfueled, so that metabolic rate has dropped. Additionally, what we see here with this protein substrate is that her body is breaking down 14.2% more of her lean mass and muscle than it should be, because again, the body's compensating for being underfueled and it needs to use something else to get that energy because she's not eating enough. So this information here is really, really important, because when somebody goes in and they're saying, hey, I'm struggling with my eating, but they present at 5'6" and 121 pounds, what happens is, again, they often get overlooked. These numbers really, really show that we can't overlook this person. This metabolic rate is so low and that protein substrate is so high, it gives us information that internally speaking, her body is not doing well, even if maybe on the quote unquote outside, we're seeing things look okay, but we know for a fact that they're not. So I think this is an important thing to address because, again, lots of times these cases get overlooked. And additionally, to be totally honest with you, a lot of people don't believe that this is a thing. A lot of people I've seen, not only in comments, but just my clients or even clients' parents will be like, oh, no, she doesn't have anorexia, her weight's fine. Which we have to make that distinction, because atypical anorexia is really, really scary. They're doing more and more research about how there's probably a large number of people in the population that have atypical anorexia, but are never getting diagnosed for the very same reason I just mentioned a minute ago, that it's getting overlooked. So if you feel like you're restricting your intake way too low, or you know that you're over-exercising, or you're terrified of gaining weight, I highly recommend you go and you see a physician or a therapist or a dietitian or a combination of the three and advocate for yourself that you need help. It's best if you can see an eating disorder specialist because they know to look for these things. I know that's not always available, but go seek treatment. It is worth it. Don't forget to like and subscribe, guys. We are so glad that you're here.